Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Beta blockers in lipid metabolism. Beta blockers in the lipid metabolism. These beta blockers will activate lipase enzyme. So this lipase enzyme will increase the very low density lipoproteins and also it increases the total cholesterol. Then beta blockers in genitourinary system. In genitourinary system, this decreases the blood flow to the placenta because the beta blockers will decrease the blood flow to the placenta. They result in intrauterine growth retardation. They will also decrease the blood flow to the penis, thus resulting in impotence. So among all the beta blockers, labetalol causes maximum impotency is by labetalol.
thank you and thank you for watching.